goodness. I think, like, a large percent of all countries have. I remember I looked it up one time.
So what do you think about universal health care? Do you feel that it is important, though?
What does anybody think about that weird nose that we just heard? Freaks me out.
Focus ahead. Let's go.
Alright, universal health care all the way. Canada's awesome. The end.
I agree. I agree. Like,
There's no reason to not have it. That's
the thing
what
is, like, there's too many benefits to it. And, like, even just speaking from experience, like, I went to the hospital in October, and, like, it wasn't life or death, but I just needed to know what was going on with my body, and I came out of the hospital with, like, a $5,000 bill.
For 45 minutes of care.
Yeah, for 45 minutes of care, waiting in the waiting room for, like, 8 hours or something like that, and then being in there for 45 minutes, and then telling me what was wrong with me, and I came out with a bill. And that's something that can ruin your credit if you don't start to pay it. I don't even have time to build my credit before it's already ruined. So, like, luckily, we only ended up paying about $1,000 of it, and then they zeroed out my account because we filed some, like, papers. But it's like, you read so many stories about people that are terrified to go to the doctor just because of that reason.
Oh, yeah.
Because even I felt the pain over summer. You remember when me and Angie went to the store that day, and I was feeling really sick.
I remember.
And
it was for a while.
And it would come and go and come and go. And I went to the doctor, and I had to pay for that and pay for blood work out of pocket. And then I had to go get an ultrasound and I had to pay for that out of pocket. And after I did all that, it was probably more than $600. And that was just within 2 days. And then, like, I waited months and months again. I'm like, you know what, it's not getting that bad. But there was just one day where I couldn't even walk. I couldn't eat. I was throwing up. And I didn't eat anything. So it was just like, I was just gagging all day, and I had to go to the hospital. But, like, I read this story about this guy who, he went to, like, a gas station or something, and he stole a bag of M&Ms, and he just waited outside for the cops to get him. And they put him in jail, and when he went into jail, he was treated for
free healthcare.
Free healthcare.
In jail.
In jail. He was that desperate. He stole a bag of M&Ms, waited for the police to come get him. He was arrested, put in jail, and...
I heard a story about the guy who stole $1 from the bank. I don't know if it's the same thing. It's a similar story, but the guy went and, like, stole $1 from the bank, and then, like, waited for the cops to come and get him so he could go to jail so he could get free healthcare.
Yeah. And then the thing is, you also hear stories about people, like, they get an infection in their tooth, and then the infection spreads, and they die because they can't afford to go to the doctor.
Right.
Like, a tooth.
Stupid.
Yeah.
It's ridiculous.
And
I agree with it, too.
Yeah.
I feel like a lot of people sit there and they, like, sit on things that are wrong with them. You know, they don't go and seek treatment when it's something that can be easily prevented, and then they wait until it escalates to the point where, oh, it's like a life or death situation now, and that's when they go to the hospital. That's when they rack up the huge bill that they have to pay for.
But think about it, though. Some people can't even afford, you know, let's say $1,000.
No, yeah, I know that. I know that. That's what I'm saying. That's the problem.
Because when I was talking to my friend about it, she has health insurance, and she told me if she went to the hospital, she would have paid $30 for what I had $5,000 bill for.
Right. Yeah.
So it's sad. And then I also have a friend, Sean. He hasn't been to the doctor in years. He hasn't been to the dentist. I don't think he's ever been to the dentist.
And he's scared because of the amount of fees he's going to have to pay?
He's not even scared. I guess he's just used to it because he's never gone.
He just knows that.
He was raised, like, you know, his mom works really hard, but they didn't have a lot of money, and he just hasn't gone. And thank God right now, like, he seems healthy, but you do need to check up. And he does need to go to the dentist. Like, I don't know if he has a cavity. He's never expressed pain to me, and his teeth look fine, but I know it's good for you to go to the dentist and get it checked.
Yeah.
Like, they always have something to tell you.
So the fact is, especially for, you know, college students, universal health care is extremely important. Would you agree?
Yeah. And even the other day, I heard my roommate talking about it, and I felt bad because, like, I guess she's kind of, like, probably upper middle class, and she's a wonderful person.
Yeah.
But she, and I thought, her mom is a nurse, and I thought, like, her mom being a nurse, her mom would have more sympathy towards people that don't have health care.
Right.
But where she's speaking, like, she kept saying, like, I was just hearing her conversation, but she's like, oh, you need to talk to my mom about this, you need to talk to my mom about it. So, like, from that, I gained that, like, her mom has a really strong opinion about universal health care. But this was her excuse as to why we shouldn't have it, because it would raise, like, even with, like, raising taxes for, like, the 1%, and then, like, lowering taxes for, like, the rest of the 99%.
Right.
She's like, oh, even though doctors make 6 figures a year, they still have to pay back the loans that they took out when they were in medical school, and that's why their taxes shouldn't be raised. But I thought that was really stupid because when have you ever heard a doctor say, oh, I'm really stressed out this month, I have to pay back my medical bills from when I was in medical school, you know? I mean, yeah, they probably do have loans that they have to pay back, but they also live in a really nice house and they can afford it.
Of course.
So I thought that was such a stupid excuse.
And I know this from experience as being someone who is currently going to school to be in the medical field. I hella know that doctors come out of med school, and sure, some of them rack up maybe like $200,000 in, you know, school fees, but after you finish with your residency, a lot of doctors tend to make like $300,000 or more, and there's like zero interest on those loans that they take out because the bank knows that they are going to pay that money back because they're going to be big balling doctors, which they are. So you're right. A lot of them are sitting there thinking, oh my gosh, I have this big loan to pay back. No. They're thinking about their boat that they got to pay off, their yacht, their big house out in West
Bentley, the Rolls Royce,
the Bentley. That's what they're thinking about paying off more so than the medical bill.
So I thought
screw that nurse lady. That's still not true.
So I thought her excuse was totally invalid. And then,
it was invalid.
Yeah, and also doctors are not the only people that continue education and go on to like get their masters or anything. So a lot of other people have, loans that they need to pay off as well. So I thought it was.
But not only that, if you're a doctor, you should be getting and hopefully getting into the profession because you love to help people. And, you know, see people get well and take care of them. That should be your primary focus.
And it should hurt you to see people that
in pain.
are afraid to, like, you always hear so many stories about people that are afraid to go to the doctor.
Oh, we should so watch Sicko. Have you ever seen Sicko?
No.
Have you ever seen Sicko?
No.
We need to watch Sicko because Sicko is basically a documentary about all this stuff about people who are afraid to go to the doctor because they don't have health insurance, and people, but more so it's about people who do have health insurance who get screwed over by their health insurance providers who are looking to make the big buck. It's a really good documentary. It's really good. I recommend it entirely. Michael Moore, Sicko.
So hopefully we'll have a discussion on Sicko.
Best documentary I've ever
I
seen.
love Michael Moore, by the way.
I've ever seen in my entire life. Best documentary ever.
And you know he's done a couple of documentaries. He's done quite a few.
Fahrenheit 9/11. He's done a bunch. But, and Capitalism, A Love Story. Those are all his documentaries that I've heard of.
It's really sad though.
Yeah, and hopefully it'll change.
I don't think it'll change, honestly.
We're hoping that it'll change.
I just feel like
I know, but I'm just being realistic.
Every step of the way.
I'm being very realistic. I don't think the Republicans, whoever's in office, who's a Democrat, Republican, whatever, I don't think they're ever gonna get over that. Like, I don't even know what it, like this wall that they put up against
to help their country.
Yeah.
So the Republicans have a majority right now, and they're fighting him every step of the way, and I feel like it's just because it's Obama.
I don't think it's just, well, I think a big part of it is because Obama, but I feel like no matter who it was, they would still be fighting it regardless.
Yeah, maybe for universal health care, but I feel like a lot of the things that he tries to do, I don't know if it's because, like, now that we're older, we're more aware of what's going on, but I just don't feel like I ever saw them fight this much. Like, and everything he says, they always say the opposite.
Yeah.
And this is coming from college students, people who are in school trying to get an education to better not only themselves, but their community and family and friends. So please bear that in mind.